We started with our topic online scheduling using Epic EHR. During brainstorming, we identified multiple issues associated with online scheduling. We narrowed down to no-shows as the main issue when patients are scheduling appointments on patient portal, as no-show appointments waste resources and decrease the sustainability of care. When we look around, we find there are large number of EHRs like Amazing Charts, Apex, Athena, Cerner, Chrono, Epic, Centricity, Hello Health, and the list is very long. It goes on and on. Criteria for selecting an EHR is always utilized. EHR should be certified by the CMS. Basic functions as specified the CMS to qualify for the CMS incentive programs such as interoperability, the functionality to generate the quality metric reports electronically for the CMS, the function of electronic order entry and management for patient safety and quality. Then other criteria are it should have sufficient storage, and if one storage fails, it keeps operating and the entire data is not lost. For this, cloud storage is ideal. Server use should be such that it enables storage and processing on multiple devices. Indexing should be incorporated so that the files are matched up to the patient in the lab and radiology. The healthcare worker, while making inputs, should be able to access patient data by clicking just on the patient name directly. EHR should be HIPAA compliant and where required, encryption should be used. Now, a few words about Epic. It's a cloud-based software. Storage of data is no problem, allows medical staff to track patients throughout the appointment and care. Great features of interoperability. That's why it is used by many government and private organizations, but it's expensive EHR and all cannot afford it. Objectives of the project, that is to reduce no-shows by patient with the goal of achieving and achieve elimination of no-shows when patients use patient portal for scheduling appointments. We are using PDCA approach in our project. In the plan, the object is to reduce no-shows by patients with the goal of achieving elimination of no-shows. If it is due to technological issues, healthcare staff will impart training to patients on how to schedule appointments at the patient portal. That is realizing importance of imparting training to patients on use of modern technology by the healthcare services so that patients become fully conversant with scheduling appointments online. Healthcare staff will document unexpected observations and problems experienced by the patient while doing online scheduling. Then in the study check, data will be analyzed to determine what works well and what does not work well and making required adjustments. Healthcare staff will also summarize the lessons learned. Act. Using the insights gained from our study, we shall act on what has been learned to reduce no-shows. PDSA cycle will be repeated after making necessary changes, modifying the plan as an ongoing process till no-shows get completely eliminated. We'll move with our discussion. Next will be defects and errors, brainstorming the root cause, asking the 5 whys and mistake proofing, goal improvement hypothesis, and comparative studies PDCA, PDSA, and Six Sigma. Finally, we will summarize, arriving at the conclusions and making necessary recommendations. Thank you. And now I pass it on to Bianca for the next topic.
Thank you, Indu, for introducing us and going over our presentation outline. My name is Bianca, and I will be discussing the problem and causes with patient online scheduling. According to our team project, the most common issue we encounter with online scheduling is patients failing to show up for their clinical appointments. I think it is important that we address this issue because it does impact the quality of care and causes poor patient outcomes due to the time being wasted on waiting for patients to show up to their scheduled appointments. It creates a slow process to the workflow, leading to inefficiency and costing the department money due to an unoccupied time slot. It also affects other patients' experience due to delaying time trying to locate the missing patients or figuring out what happened that led them to no-show. This defect is related to human causal factors involving proper communication to manage effective scheduling. Therefore, we need to investigate the reasons why patients fail to show up. To improve or prevent this from happening, we need to brainstorm and identify the root cause. With that said, our team decided to apply the 2 quality tools to help us determine the root cause. The first step is applying the 5 whys to narrow down. Our next step was creating a fishbone diagram to
Thank you, Bianca, for discussing the issues and reasons why patients do not show up for their appointment. The data report that I've gathered is through my work, and this is also one of our challenges.
Thank you, April. My name is Elsa. I am doing recommendation. I am recommending PDSA for reducing patient no-show rate. PDSA is a quality improvement framework that stands for Plan, Do, Study, Act. It can be used to improve patient no-show rate in healthcare setting. Here is how PDSA can be applied. First, plan. Define the problem and set measurable goal. For example, the problem could be not a patient no-show, and the goal can be reducing no-show rate by 20% the next 3 months. So identifying the problem, and then, it could be patient forgot the day and time of the appointment. It could be lack of transportation, could be scheduling conflict, they might be working that day. They might have, something very important, and then the other one is health-related issue. It could be, the patient's health condition. So the measurable goal is going to be, 20%, reducing by 20% the next 3 months. So now do. So implement a change. So there are several changes that can be made to reduce no-show rates, such as an appointment reminder. It could be calling, texting, and then leaving a voicemail. And also like a flexible scheduling. It could be, we can make this reschedule on a patient's convenient, and then it could be improving communication with patient, and then so also it can be offering telehealth doctor visit for patient who's busy with schedule, or who has health related issue or transportation. So we study, like measure the result after implementing the change, collect data on the no-show rate, compare the data with the previous no-show rate to see if there is any improvement. So study, make observation, and collect data, and then analyze the data collected and identify what works well and what it didn't. So making an adjustment using information from the intervention. So then act. The act is reflecting on the result and make an adjustment. Based on the result, make an adjustment to change that were implemented. If no-show rate have improved, consider implementing the change in a larger scale. So if the no-show rate have not improved, consider trying a different change. So using the insight gained from implementing revised intervention, and then repeat the cycle, repeat the PDSA cycle, making an adjustment, set another standard, and then repeat the PDSA cycle, and then refine intervention over time. And then set a new goal and evaluate its effectiveness. Thank you. In conclusion, by using the PDSA process improvement method, we can reduce patient no-show. So reducing patient no-show by certain percent for a certain amount of period, and then also providing patient-centered care by offering different options that is convenient to patient, and then helping patient accessing primary care, and then providing efficient and then timely health service that improve patient health outcome. So by using the PDSA framework, healthcare providers can identify and implement change that can improve patient no-show rate, and then improve overall clinic efficiency and increase revenue. And then providing patient-centered care that improve patients' health outcome. Thank you so much for listening to our presentation.
I want to thank my teams for sharing their insightful ideas about our main objective of